I beg to move that this House do now adjourn.
The question is that this House do now adjourn. Charlie Dewhirst.
Thank you, Madam Deputy Speaker, for the opportunity to debate this very important subject of health services in Bridlington, and thank you to the Minister for being here this evening. I'd like to thank everybody I've spoken to in advance of this debate, and in particular the Bridlington Health Forum and representatives from local NHS trusts and the Integrated Care Board. And while Bridlington is not alone in needing improved access to health services, I will seek to outline today why it has become an extremely acute problem in the town. Other constituents of mine living in and around Driffield and Hornsey and Market Wheaton and in the remote Wolds villages will have valid concerns about their own public services, but I hope they will forgive me this opportunity to speak in depth about Bridlington and why it so needs extra support. I will set out in this debate the demographic backdrop against which these issues have arisen, the challenges over supply of services, and lastly, the need for a robust strategy to tackle the various problems faced by local people in the town. Bridlington is a fantastic coastal resort on the edge of the rolling hills of the Wolds, and it welcomes millions of visitors every year. It is world famous for its seabird colony and is the lobster capital of Europe. But like many seaside towns, it has significant challenges, and the demographic data is stark. Bridlington has the oldest and most deprived population in the East Riding of Yorkshire. Men living in the Bridlington South Ward have a life expectancy 10 years lower than those living elsewhere in the county. Indeed, data shows that 2 of the 3 wards covering the town are the 2 most deprived wards in the county, and the other is 5th highest out of a total of 26 wards. The age profile is also equally stark. 1/3 of the population are over 65, and that rises to 44% of residents in Bridlington North, where a significant number are over 80 years old. Bridlington has the highest percentage of people with limiting long-term illness or disability in the York and Scarborough NHS Trust catchment area, and Bridlington residents have the highest levels of health inequality in that catchment. The Director of Public Health for the East Riding has said about the town, "We have found that the inequalities are growing, they are large, they are serious. In terms of length of life, quality of life, and the amount of people with long-term health conditions, Bridlington has got the worst levels in all of the East Riding, so this is a wake-up call to do something about it." And I certainly can't, Madam Deputy Speaker, disagree with that sentiment. Moving on to the supply of health services, you will no doubt be shocked to hear there are entire classrooms of children in Bridlington who have never seen a dentist. One patient needing emergency dental work was sent more than 60 miles to Doncaster, and in January there were 8,500 people on the waiting list for the local NHS dentist. Many people have been forced to go private, but that is not a solution affordable to most. Will the Minister agree to look again at NHS dental contracts so they incentivise dentists to open practice in areas where there is such a clear and obvious shortage? Access to primary care has seen some recent improvements, but the consolidation of GP practices from 6 to 2 has not been without its problems. Local patients are still finding it challenging to secure appointments at one of the 2 practices, but I know the GPs operating across the town have worked tirelessly to improve services in the wake of the pandemic and shortage of local healthcare professionals. The direction of travel for secondary care, however, is not positive. Bridlington is blessed with a fantastic hospital site opened in 1989 and which recently enjoyed an investment of £4.7 million in 1,500 solar panels to make it one of the greenest NHS sites in the country. However, that site is chronically underused. Now, I'm not suggesting for a second that the Bridlington Hospital site could be a major trauma centre or large infirmary, but it can and should be a vital community asset for health. It has the potential to be a health hub for the town, bringing together a wide array of local health services. York and Scarborough NHS Trust might not be the owner of the site, but they are the providers of secondary care there. Many in the town fear that their focus, which is naturally leaning towards North and not East Yorkshire, means that investment and new services are being prioritised in York, Scarborough and Malton. Outpatient appointments are a particularly key metric, as they make up a large bulk of the interactions between the NHS and the older people in Bridlington. The number of outpatient appointments at Bridlington Hospital offered to residents in the Bridlington, Driffield and surrounding area has reduced from 46,500 in 2019-20 to just over 27,500 in 23-24, a reduction of 35% in just 4 years. Ophthalmology appointments are down, audiology appointments are down, rheumatology appointments are down. Instead of recognising that an ageing population will result in greater demand on outpatient services locally, we are seeing these services provided at sites away from the town. I'd be delighted to give way.
Madam Deputy Speaker, could I commend the Honourable Gentleman for Bridlington and the Wolds for bringing this forward. He and I knew each other long before he became to this House in the APPG for eggs, pigs and poultry. He was one of our advisors. So it's really a real pleasure to see the Honourable Gentleman here in this place, and we look forward very much to his contributions. His constituency and my constituency are very similar. He mentioned the issue of being a seaside resort. He mentioned the issue of the seaside areas that he represents and I represent. He also mentioned the fact that the population is over 70-year-old. Again, similarities. Is the Honourable Gentleman seeking a new strategy and rural strategy that addresses the issue for coastal areas? If he is, then I think it's something that we could all welcome.
Thank you very much, and I thank the honourable member for that contribution. Absolutely, and I'll come to that point shortly in my remarks. The East Riding patients travelled an astonishing 2.7 million NHS miles to attend outpatient appointments in 23-24, and 2/3 of Bridlington residents are attending outpatient appointments away from the town. This isn't acceptable, and I won't stand by and let it continue. But part of the problem is that local members of Parliament have very little, if any, direct influence over the direction of our health services, and that is why I'm appealing to the Minister for his support today. And I believe this is particularly timely. In his recent report, Lord Darcy described the NHS as broken, and in the case of Bridlington, he is correct. He states that an ageing population is the most significant driver of increased healthcare needs since it is associated with the development of long-term conditions. And by the time people are 65 to 74, a majority will have at least one long-term condition, and some 40% will have two or more. By the time people are aged 75 to 84, this rises to 60% having two or more, and by the time they are 85 and above, 9 out of 10 will have at least one long-term condition. I remind the House, Madam Deputy Speaker, that 1/3 of residents in Bridlington are aged 65 and over. Lord Darcy makes the following very pertinent observation. At the highest level, the NHS has had the strategic intention to shift spending from reactive care in hospitals to more proactive care in the community setting, but care has in fact moved in the other direction. This is very much the experience of my constituents. The report also makes clear that care should be more joined up and more integrated to reflect the fact that people are living with long-term conditions need more support, a variety of different physical and mental health professionals, and often rely on social care too. The frequency of their interactions with the health service means that their care is more complex and therefore requires coordination. Finally, on this point, Madam Deputy Speaker, Lord Darcy is right when he says that care should be delivered in the community, closer to where people live and work, and that hospitals should be reserved for specialist care. This is more convenient for patients, especially those with long-term conditions who will need more contact with the NHS more frequently. And I would also like to refer the House to the Chief Medical Officer's 2021 annual report on health in coastal communities. In this very insightful piece of work, Sir Chris Whitty noted that given the high rates of preventable illness in these areas, the lack of available data on the health of coastal communities has been striking whilst researching the report. Coastal communities have long been overlooked, with limited research on their health and well-being. The focus has tended towards inner city or rural areas, with too little attention given to the nation's periphery. He went on to add that data is rarely published at geographical level, granular enough to capture coastal outcomes, with most data only available at local authority or CCG level. As a result, deprivation and ill health at the coast is hidden by relative affluence just inland, which is lumped together. In conclusion, he recommended that given the health and well-being challenges of coastal communities have more in common with one another than inland neighbours, there should be a national strategy to improve the health and well-being of coastal communities. Unfortunately, and perhaps as a result of the health service working its way through the impact of the pandemic, the report has been somewhat sidelined and the recommendations have yet to be acted upon. So what, Madam Deputy Speaker, should be the solution? Well, we need a comprehensive strategy bringing together all parts of the health service that recognises the challenges and puts together an immediate action plan. The Humber and North Yorkshire Integrated Care Board is trying to address these issues, but I am concerned about exactly what their role is or should be. Some ICBs interpret their population health duties as requiring them to act upstream of healthcare needs on the social determinants of health, where the NHS has few direct levers. Other ICBs interpret their duties as requiring them to understand and adjust healthcare services to match the needs of the population that they serve in line with the NHS operating framework. Some interpret it as both, others as neither, preferring to focus on what they see as their traditional role of performance managing providers. Ultimately, their roles and responsibilities need to be clarified so they can be better held to account. This is not a criticism of the performance of my local ICB, who are working hard to tackle the challenges, but I think we would all benefit from a greater clarity of purpose. In conclusion, Madam Deputy Speaker, we cannot escape from what is in front of us. As one senior local authority figure commented to me, the health crisis in Bridlington is not a car crash waiting to happen, it is happening right now. And my appeal to the Minister today is simple. I have no doubt that he has the very best of intentions when it comes to improving the nation's health, but realistically, many of those ambitions will take decades. But if he wants to make a real difference today, please focus some of your department's collective effort on tackling the enormous health inequalities in seaside towns like Bridlington. Please take the recommendations of Lord Darcy and Sir Chris Whitty and apply them to our town. We are happy to be your pilot scheme, we are happy to be your trailblazer, because I know with the right energy and direction we won't be left with a generation of children who have never seen a dentist. We won't have elderly people travelling long distances for regular routine appointments. We will have a health service to be proud of, and we will have a happier and healthier local population. So I implore the Minister and his department to work with me to ensure a better future for the brilliant people of Bridlington.
Minister Stephen Kinnock.
Thank you very much indeed, Madam Deputy Speaker, and I'd like to congratulate the Honourable Member for Bridlington and the Wolds for securing the debate and also for the very constructive tone in which he put his comments forward. Madam Deputy Speaker, this government is committed to fixing our broken health and care system. As my right honourable friend, the Secretary of State, has said, we will be honest about the problems facing the NHS and serious about tackling them. The honourable gentleman is absolutely right to raise the problems in Bridlington, which sadly will be familiar to colleagues right across the House. And the truth is we are very, very far from where we need and want to be, as he has so rightly set out. He talked a lot about Lord Darcy's report. I'm very pleased that he's read it and would appear to agree with the true extent of the challenges that it set out. And even Lord Darcy, with all of his years' experience, was shocked by what he discovered. But the report was vital because it gives us the frank assessment we need to face the problems honestly and properly. It will take a decade of national renewal, lasting reform, and a long-term plan to save our NHS. We've committed to 3 big shifts, from hospital to community, from analogue to digital, and from sickness to prevention. Our 10-year plan will set out how we will deliver these shifts to ensure that we have a health and care system that's fit for the future in Bridlington and across the United Kingdom. To develop that plan, we must have a meaningful conversation with the public and those who work in the health system. So we're going to conduct a comprehensive range of engagement and consultation activities, and that's going to be launching very, very soon indeed, bringing in views from the public, the health and care workforce, national and local stakeholders, system leaders, and very importantly, given the Honourable Member's comments, parliamentarians are going to have an opportunity to feed into this very important national conversation. It's going to be the biggest national conversation about our health and care system since the foundation of the NHS in 1948. The government is committed to restoring our health and care system to its founding promise, that it will be there for all of our constituents when they need it. So I hope that context helps him to understand that we're taking this very seriously, that we don't want to be making policy in the ivory tower of Westminster or Whitehall. This needs to be a national conversation feeding in to a 10-year plan that will then be published in the spring of next year. I wanted then, with your permission, Madam Deputy Speaker, to just address some of the specific points that the honourable gentleman raised. Firstly, on dentists. I absolutely share his concern about dentistry access. The single biggest cause of children aged between 5 and 9 being admitted into hospital is to have their rotten teeth taken out. It is frankly a disgrace. As the Prime Minister said a few weeks ago, it's soul-destroying for those young people, and it's something that can so easily be prevented. That's why we will work with the sector to reform the dental contract with a focus on prevention and the retention of NHS dentists. But in the meantime, we know patients can't wait, and we will not wait to make improvements to the current system where these can increase access. That's why we're working to deliver our rescue plan, to provide 700,000 more urgent dental appointments. They'll be available across the country, including, of course, for the residents of Bridlington. I'm aware that an initial procurement for the additional service in Bridlington was unsuccessful. The ICB has since reviewed this specification and is working to further understand what may work best for the town, with preferred options for procurement due to be approved this month. The Honourable Gentleman also raised the issue of GP access. Unfortunately, people across the country will recognise the picture he describes in Bridlington. Almost everywhere, patients are finding it increasingly difficult to see a GP, and when they can't get an appointment, the chances are they end up in A&E. This is unacceptable, worse for patients and more expensive for the taxpayer. Lord Darcy was clear the situation is particularly acute in certain areas, to the Honourable Gentleman's point about health inequalities, and I know Bridlington is one such area. Our plan starts with recruiting over 1,000 newly qualified GPs through an £82 million boost to the additional roles reimbursement scheme. In the longer term, we're committed to training thousands more GPs, guaranteeing face-to-face appointments for all those who want one, delivering a modern appointment booking system to avoid the 8 a.m. scramble, and ultimately shifting resources from acute care and into primary and community care. He raised the recent merger of GP practices in Bridlington, where 6 practices have been consolidated into 2 larger practices. These decisions are made, of course, by local commissioners who determine what services and care pathways best serve the needs of patients in the area. I am pleased that performance has improved in both practices, with one demonstrating some of the best access with the Integrated Care Board footprint. But of course, there are still issues, and the people of Bridlington deserve better. That is why we are committed to delivering our plan for primary care. The Honourable Member also raised Bridlington Hospital, which currently provides a range of services including an urgent treatment centre, radiology, rehabilitation and inpatient surgical wards and outpatient clinics. Patients attending these services can and often do come from outside the Bridlington area, but I'm aware that there is more space at the hospital which can be used, and I can assure him that we're looking carefully at capital requirements as part of the spending review. We'll know more about that on the 30th of October. So I hope I've addressed some of the concerns the Honourable Gentleman raised. I absolutely agree with his view about health inequalities. It's quite shocking to hear the difference between just one ward and another ward in his constituency. Those gaps have to be narrowed. A lot of this is about ensuring that it's not just people living longer, but they're living longer, healthier lives, rather than this increase that we're seeing in complex conditions at a younger age, which is creating huge pressure on our health system and is not good for the people of his constituency either. So I absolutely understand and see the context in which we're operating, and that's a top priority for the 10-year health plan that we're bringing forward. So in conclusion, I wanted to thank the Honourable Gentleman again for bringing this issue forward, giving me the opportunity to reiterate our promise from this dispatch box to fix our broken health and care system, delivering for people in Bridlington and across Yorkshire. Sadly, the situation he describes does resonate with the broader findings of Lord Darcy's review. The health and care system is in a critical condition, but I can assure the Honourable Gentleman that this government is committed to getting our health care system back on its feet and fit for the future. Thank you, Madam Speaker. I will give way.
Conclude. Thank you very much, Madam Speaker. Just on particular issue around coastal towns, and Bridlington is not unique in the challenges. Will you pledge to me to look at that broader recommendations of Sir Chris Whitty's report of 2021?
He makes a very important point, and one of the trends we're seeing, of course, is an older demographic is moving to coastal towns. Those towns often are most challenged in terms of being under-doctored, often are dental deserts, and are also lacking in social care facilities. So you've got a toxic combination of the demographics and the additional pressures they cause, and the lack on the supply side of what is required. So he's absolutely right to identify this issue around coastal towns. I know that our Chief Medical Officer, Chris Whitty, is very alive to that issue, and that is absolutely going to have to be factored in to the 10-year plan. The 10-year plan can't just be about the sectors that we're looking at. It's also about geography. It's also about the lived experience of people in particular parts of the country.
The question is that this House do now adjourn. As many as are of that opinion say aye. The ayes have it. The ayes have it. Order. Order.